Hello, everyone. It's my pleasure to welcome you to today's seminar. This is the third in our series, Global Pandemics in an Unequal World, which is jointly organized by the New School Studley Graduate Program in International Affairs, Health Policy Watch, and the Independent Panel on Global Governance for Health. My name is Katerini Storing, and I'm speaking to you from the University of Oslo's Center for Development and the Environment, where I am Associate Professor and also lead a new project called the Smartphone Pandemic. So today we are turning our attention to the role of digital technologies in the global response against COVID-19. Over the past few months, we've seen really an explosion of new digital technologies such as contact tracing apps and mobile phone localization data, which is being used to model and monitor and control the pandemic. The use of such technologies can invoke images that are quite dystopian of Big Brother digital surveillance, but also of utopian hopes that technology will help curb the pandemic and allow us to somehow return to normal. Of course, these developments raise a number of crucial questions that we want to discuss here today, such as, can digital tech really replace old school public health measures, and at what cost? Will new digital surveillance technologies benefit public health or deepen existing inequalities? And will they enable social control of vulnerable groups or political opponents? Finally, what are some of the implications of the increasing role of big tech companies in assisting governments with managing emergencies like COVID-19? We're really privileged to have with us a great panel of experts to discuss some of these questions and more, hopefully. I'll introduce them briefly before we start. First, there's Stephen L. Roberts, who is LSE Fellow in Global Health Policy at the London School of Economics and is about to take up a new post at University College London. Manjari Mahajan is Associate Professor of International Affairs and at the New School in New York City, where she studies global health and digital governance, among other things. Susan Erickson is a medical anthropologist and Professor of Health Sciences at Simon Fraser University in Vancouver, Canada. And finally, Sean McDonnell is a lawyer and Senior Fellow at the Center for International Governance and Innovation and co-founder of Digital Public, as well as CEO of the technology social enterprise Frontline SMS. So today we're going to be proceeding as a moderated conversation and hope also to have time to bring in audience questions at the end. Please pose your questions via the chat box and also feel free to engage with us on Twitter. We suggest using the hashtag COVID Inequality. So I'm going to turn to Stephen first, because Stephen, you've been studying the digital turn of infectious disease surveillance systems in countries' efforts to prepare for a possible pandemic for some time now. Now, what is new in the technologies that you're now observing being deployed in response to the current pandemic in the UK, where you live?
Well, thank you, Katerini, and welcome everyone. I'm very happy to be discussing this really critical topic with everyone today. So I think one thing it's really critical to know in the discussions of what we're witnessing with the COVID pandemic and the technologies that are being rolled out is that the digitization of infectious disease surveillance, it's not novel, right? We can trace things back as far as 25 years ago with techniques like ProMed Mail. That essentially was a listserv online that sent alerts to health policymakers about potential outbreaks. And we can talk about the Global Public Health Intelligence Network in the early 2000s. We can talk about Health Map as well. So I don't think these techniques are new, but I think what we are seeing is a real intensification on one hand of techniques like facial recognition programs, artificial intelligence, again, big data analytics, being rolled out in the context of this pandemic in a way that we haven't seen previously. And also on the other side, and you spoke about it just a moment ago there, we'll unpack further discussions today as well, is that we're seeing an intensing merger or union of big tech increasingly partnering with states to provide the infrastructures and the technologies to track COVID. So I would argue rather than something new, it's an intensification of what was already there.
Thank you very much, Stephen. I'm going to turn to Susan. I mean, you live in Canada, where Trudeau has recently announced that there will be a Canadian version of the contact tracing app called COVID Alert available for download in the next few weeks. I understand it's going to be tested in Ontario before a national rollout. Can you tell us a little bit more about the role of digital tech in Canada's response to the pandemic?
So thanks so much for inviting me. Happy to be here. In Canada, you know, health is actually governed by the provinces, but there is, of course, a role for the federal body. I can say that Trudeau's rollout has been a bit half-hearted in terms of compared to when he enthusiastically endorses things. And I think it has a lot to do with the kinds of conversations that people have been having in the different provinces about the app. So we saw an app rolled out in the end of April in Alberta, and you know, they didn't have a lot of uptake. I don't know that they have even reached 250,000 people. So the app is available, but because it requires voluntary uptake, you know, this is part of the issue that is happening. But two things I just want to start my own contributions with is this question of whether or not these apps actually work to both reduce human suffering and meet public health needs. And then if they're not really working, because there's a lot of evidence to suggest that they're not, then what are they actually doing? And I think a political economy analysis is really essential to the conversations that we're having. They're not meeting our public health goals. What else might they be doing? And I look forward to that conversation.
Thank you very much, Susan. It's a nice segue to Manjari, because of course in Canada and in many European countries, there's been a lot of emphasis on the voluntary use of any digital surveillance technology. Now, this is not the case all over the world. Manjari, you are co-director of the India-China Institute at the New School. And one of the things we've seen in the international media over the past few months is a criticism of the way in which India's efforts at digital contact tracing are being reappropriated as a vehicle for social control that some have claimed is really turning the world's largest democracy into a surveillance state where people are basically forced, in some positions at least, to download apps, and those who are not able to do so are not able to go about their lives freely. Can you comment on this from your vantage point?
Thank you, Katerini. So, you know, the adoption and the discussion of digital technologies in India in the context of the COVID epidemic simultaneously is revealing the fragility of the health system, the regulatory system, the public statistical system. And at the same time, it's pivoting attention away from these institutional weaknesses. So the app that you are referring to is a contact tracing app called Arogya Setu, which has been rolled out by the central government, which is our federal government. It has been downloaded, the last time I checked, over 70 million times. Strictly speaking, legally, it is supposed to be voluntary, though there are all sorts of other constraints which compel people like public sector employees to download it, perhaps in involuntary contexts. There have been other ways of contact tracing also that governments at city levels, at state levels are increasingly adopting. One of them is sharing of mobile phone data with the police to determine location for contact tracing purposes. But I think the domination of the discussion by contact tracing apps in some ways is distracting us from other digital technologies, which in some ways are shaping the response to COVID, perhaps in more powerful ways. So just a couple that I'll mention in the context of India. One is communication platforms like WhatsApp, which are crafting entire new public spheres for disseminating information, misinformation, deliberation, dissent, and that needs our attention. There are whole digital, menu of technologies, apps, but also other things for service delivery. This includes things like telemedicine portals, but also using existing biometric-based ID platforms like Aadhaar for determining service delivery. And then there is this whole wild west, if you will, of discrete apps that are being proposed by entrepreneurs and being funded by philanthropies and governments for addressing a whole host of different issues, maternal health, hygiene, how to celebrate festivals in socially distant ways. And that is actually a very big part of the digital technologies in India in the COVID context. Just to take up from where Susan left, some of the things that I hope our discussion will touch upon is, one, there has been a lot of discussion in the United States and in Europe on the role of big tech and on concerns of privacy and surveillance. And I think what the case of India and China really teach us, but also other countries, is how important governments are in understanding the landscape here. The second thing is how lopsided the public, but also scholarly and academic discussion is about digital technologies, where there has been an enormous focus on questions of privacy and surveillance, which are undoubtedly very important issues. But there is a systematic silence on a whole host of other issues which should also be on the table. And I'm just going to mention 2 or 3. One is, what kind of data and knowledge is going to be produced to know populations and know problems? How will this affect minorities, marginalized groups, free speech issues? The second issue, which is not really being discussed explicitly enough, is how this is really reconfiguring citizenship and the geography of claims making, rights and responsibilities, and the relationship of citizens to states. The third set of questions which seem glaringly absent are questions of technology development, old questions of economic control and equity. And some of these debates, ironically enough, are taking place around the other set of technologies in the COVID space, namely around biomedical technologies, right? So around vaccines and diagnostics, there is a very rich discussion on where are they being produced, by whom, for what purposes, how are we defining success, is it being tested adequately for safety before it gets rolled out? And that discussion, when it comes to digital technologies, is glaringly absent. And, the cases of India and China, but I would remark many other parts of the world too, really behoove us to have those questions on the table.
Thank you very much, Manjari, and also for directing our attention to the fact that these digital tracking apps that have received so much attention are really only one part of a vast landscape of applications and technologies that are being deployed in different ways, some of which are old, some of which are new, but all of which involve challenges of ownership, of regulation, and of state-citizen and private company relations. And I want to turn, therefore, to Sean, because at the start of March, before COVID was even labeled a pandemic, you referred to it as a digital governance emergency of international concern, and also predicted that the digital tools and tactics and powers that we developed during this response will lead to future attempts to manipulate markets, borders, and politics. Are we already seeing your prophecy coming true?
I would love to believe it was prophecy, as so much more just sort of hard-won lessons from previous engagements. So I think, my background in contact tracing started during the Ebola epidemic, and my work at Frontline SMS is very much about creating last-mile connectivity. And a lot of what we saw kind of in the response to the Ebola epidemic was a very similar push to big data analytics, doing sort of analysis and public healthcare without the public in a lot of instances. And so I think that, all of the other panelists' points, actually technology theater as a term is also the name of a piece that'll come out in CG in the next couple of weeks, but it is essentially about the use of expert debates about the technical features of a tool, instead of a meaningful conversation about the equities and power relationships that tool might affect. And so to Professor Mahajan's point, I think that obviously there are a lot of dimensions of the power politics that play out through these tools, but yeah, we are seeing it now in terms of, Norway and Lithuania have both shut down their contact tracing apps as being not necessary or proportional. The heads of almost every major contact tracing program that has achieved any legitimacy has said that the benefits of the technology are marginal at best, if not actively harmful, as in Israel. So we're seeing there's a lot of, to other people's points, there's a lot of question of why exactly is this what we're focusing on in the middle of an emergency that is so much larger. And, to the US context, I think that we're certainly seeing the role of government and the role of distraction from really core important problems about capacity and competence getting tossed into conversations about the instrumentation of a very narrow subset of the total public health response. So we're seeing lots and lots of tensions. I think the thing to focus on, if we're thinking about it as a digital as a governance emergency, is that the institutions that are designed to uphold our sort of collective credibility in public health are the ones that are suffering the most. If you look at the WHO, for example, it's seeing political challenges on all sides. And that's one of those places where when we elevate the role of technology and not focus on the clear and transparent approaches that we've taken to scientific progress and evolution, I think we start to make space for this kind of political fragility. So in a long-winded way, yes, I think it's coming to pass.
Thank you, Sean. But just to go back to Manjari, because I know you also were interested in commenting on the role of the WHO and another international organization in this space.
I mean, just to take up where Sean left off, the challenge of governance that we are seeing really here is in part because what we are seeing is a convergence of two spheres, which have traditionally been regarded as separate spaces. So one is of international public health or domestic public health, and there is a whole tradition and history of regulation and laws and ethics around that. And then the second is the space of digital technologies, which has a very distinct history of governance and regulation, which is far more nascent, both at the international level and definitely also in domestic spaces, whether it be in the United States or Norway, or definitely India and China. And what you see here, when you look at the question of digital technology in the COVID space, is a convergence of these two spheres, which really renders questions of governance as being extremely complex. And at least in a country like India right now, governance both at a formal level of regulations and laws and at an informal level in terms of guidelines and ethics and norms is extremely ad hoc. You just don't have robust frameworks within which to think about the governance of these new technologies.
Thank you, Manjari. I mean, Stephen, you are also among those who've noted the growing unease with the new forms of partnerships between governments and large private tech corporations. For example, the recent partnership between the UK, Google, Amazon, and Palantir. What's your view on these kinds of relationships? Are they a necessary evil in managing the pandemic, or should we be able to rely on governments to provide public health on their own?
That's a really fascinating question, and I think if I've discovered anything in the context of these outbreaks, it's very hard to be black or white kind of in responses with this. I think what I can say, Katerini, is definitely in the UK right now, with everything that's been going on, obviously with our own much delayed and then ditched contract tracing app, discussions whether to pursue decentralized or centralized approach with this particular app as well. And also the partnerships that get involved, is that there is very widespread public concern about these big tech partnerships. Obviously very contextual in the case of the UK, because what we have had basically in the past, in 2015 and 2016, we had the Royal Free London Trust Google DeepMind scandal, which involved the partnering with one of the trusts in London, the transfer of millions of identical patient files without explicit consent of the users and the patients as well. So what I would say is that it's very much in the sphere of public debate in the UK as well. There has been a lot of alarm with the particular partnerships talking about the data store with NHS in the context of this outbreak, which involved partners like Palantir and Google as well. So very much critical questions that the British public want to hold the government accountable for in terms of explanation.
Thank you very much. Stephen, I mean, I see we've seen in the news recently that the growing role of tech is challenging some very established power dynamics. And in the past week, we've seen France claim that Apple and Google's refusal to let public health authorities there access its contact tracing technology as an attack on its digital sovereignty. And yesterday, the advisor to the president of Latvia on digital and information policy wrote in The Guardian that they ran into what she called a Silicon Valley built brick wall when they wanted to harness smartphone technology for contact tracing there. And asked really the question, why are Google and Apple dictating how European democracies fight coronavirus? Would anyone in the panel like to comment on this question?
Well, I might just jump in here with a response.
Yeah.
They're dictating the terms and conditions of engagement in large part because there is such a divide between what tech is and who knows what tech is, and public health officials who are making decisions. And I do see a role for social scientists in terms of explaining to policymakers how these apps work. Because the tech community takes a lot for granted. And it's, you know, as an anthropologist, it's very much like going into a new community where you don't necessarily understand the language, and it helps to have a translator to help you understand exactly how the apps are working. Another piece of this is that, you know, to borrow Milton Friedman, his point about the business of business being business, this seems to be something that's really gone missing in the conversation. And the fact that it's not just about what's happening today on the part of businesses in terms of how they're thinking about these technologies, it's about what they're projecting will be their market share in 10 and 20 years. And so the data that they collect today will help them determine their products for tomorrow. And their products for tomorrow, you know, they have very little interest in actually serving people without money. And the only defender of the folks unable to necessarily gain the public health goods that they need to not only survive but thrive is the government, as imperfect as governments are. And so the fact that people aren't, and we haven't for the last couple of decades, worked very effectively at keeping the businesses in check. And now there's this knowledge divide. It's not just a digital divide, it's a knowledge divide between the policymakers making decisions and the tech folks that know how these things work. And that knowledge divide, I think, is really pretty detrimental to rolling out technology that can help us and that will really achieve the equity goals that governments are there to defend, but that businesses really have very little interest in preserving.
Yeah, I'd love to, jump in, just sort of two quick thoughts. You know, I think that there are good governments and bad governments and good businesses and bad businesses. And so, you know, we can, of course, everybody's aligned around profit. So no one's trying, you know, with a fiduciary duty to shareholder maximization. So understand a certain amount of that. But I think that Professor Mahajan's point, you know, I think we're all in certain ways kind of not saying the one thing which we really mean to say, or maybe we're all saying it, which is that governments fundamentally haven't figured out a real way to exert power over digital actors extraterritorially. And so, you know, whether we're talking about COVID diplomacy, or whether we're talking about, you know, the German public authorities' consistent threats to break up Facebook, an American company, you know, what we're really talking about at this layer of governance is how it is that we design the relationships that effectively kind of model for dependency, that model for accountability, that model for contextualization inside of local ecosystems and norms. And so I think that, you know, to Professor Erickson's point about it is a lot like a culture kind of learning to speak the language for the first time, humanitarian technology isn't particularly new. But what governments and humanitarians both do is devalue their own authority in these situations. We actually don't necessarily need to know all of the intricacies of how a technology works to say it is illegal to use a technology to hurt people. In fact, aggravated assault will do this in many instances, right, as just as a legal category. So I think a lot of what we're looking for are ways to hold both the integrity of our relationships in a higher regard to be effective. And I think a lot of that happens through supply chain contracting in these instances. And I think when it comes to sort of public authorities, a lot of what we're trying to figure out is, you know, how to move beyond broad brushes and to realize the sort of power of regulating use, and the, you know, a country still has the choice not to deploy these apps knowing they don't do anything. They don't have to do this. And I think that there's a real narrative of inevitability around technology that harms these much more important and sometimes slower conversations around equity and power.
Can I jump in here? Because I think the point that both Susan and Sean have made is absolutely critical. And it's really about the larger public narrative that exists around technology and digital technologies, but also all other kinds of technologies, vaccines, drugs, what have you, where whether it's talking about use or governance or regulation or ethics, we tend to talk about technologies as discrete things, right? Which come in an incisive way and have an immediate direct impact, which can be measured, and you can say, well, this is how it works. And I think everything that we have learned as historians, as anthropologists, as social scientists, as lawyers, etc., is that that's not how it is actually useful to talk about technologies, whether they be apps or vaccines. One has to talk about larger socio, legal, political systems within particular historical and local contexts. And that has to be the unit of analysis. And we have to somehow pull away from this temptation to talk about this vaccine or that app and find a messier way of talking about larger socio-technical systems in a historically situated, politically situated way. And that's what the discussion should really be about.
Thanks, Manjari. And I think also what Sean was saying about the challenges that governments face when they haven't really figured out a way to exert power over the technology companies that sit with the knowledge and have the capacity to do it. I think it's something that a lot of governments are grappling with. I know that that Stephen wanted to add a point to this discussion. Stephen,
yeah,
please.
I mean, I think excellent points, everyone, and I think we're so aligned on this particular topic, and I think kind of getting back to the earlier point of discussion, this concept, Katerina, which I think you brought up of digital sovereignty, which has been sort of, it's been echoed now in the European Union member states' relationships to big tech firms and contact tracing apps in recent weeks, and calls amongst the five big EU member states for the need to sort of practice digital sovereignty. I think in these discussions it's so important. And again, I think speaking to Susan's part, this is really critical where social scientists can come in as well. What do we mean by states need to practice digital sovereignty, or the EU needs to practice new forms of digital sovereignty against tech companies, right? And when we're talking about these things, if it's not necessarily empty rhetoric, well, what does that mean? If that becomes a policy in sort of the post-COVID-19 surveillance landscape, what is the role, for example, of states in the EU in practicing? What is the role of the citizen, right? And how do we communicate what best practices in things like digital sovereignty are going to look like?
And if I can just jump in again, if we break down digital sovereignty and actually ask the question, what in fact does that actually mean? It often means, like on the ground, for a policymaker rolling it out in a public health system, it means technical sovereignty. Which technical system is going to be sovereign when you're trying to actually integrate information from a contact app into a public health bureaucracy where there's humans sitting in cubicles actually making those contact tracing calls. So the issue of, does your app require a certain operating system that a bureaucracy might not be up to date on? Does the app have sovereignty? Is there a technical sovereignty imposed on a government system because the government system isn't up to date enough to actually impose its own sovereignty? So digital sovereignty, we need to unpack what that actually means on the ground and ask questions of who rules, whose system rules? Is it the government system? And I don't mean in the way of laws and rules and regulations. I mean in the engineering kind of sense of what does it actually take to integrate technologies into public health bureaucracies? And what does it mean when the systems of the bureaucracy has to accommodate these new systems? And you think of it in terms of time in the middle of an emergency, and like what we're facing now with the pandemic. And and these are, engineering kinds of questions as well as governance questions. But I think it's because I'm an anthropologist, I tend to care a fair bit about what actually happens in these bureaucracies when these technologies are brought in, supposedly to actually help, but in fact actually hinder response.
So as someone who does a lot of that technical integration and does it in emergency contexts and in a pretty broad variety of contexts, it actually mostly comes down to governance. I know that there are lots of ways that you can get trapped into the technology, but if you get the roles and responsibilities correct, or if you get the sort of power relationships clear at the beginning, the technology pieces typically fall into line. That's not to say it's easy or that it's obvious. Most times people are not renegotiating contracts or doing the kinds of due diligence that you're describing. One of the things that's fascinating in the sort of broader humanitarian technology debate right now is that initially technology was treated as this way that we could significantly increase the speed of response, right? It is this sort of force multiplier by presumption without actually a whole lot of evidence. And what we've seen in emergency responses since Haiti is that immediately you get into coordination challenges, the way that humanitarian response has always gotten into coordination challenges, and that a lot of those coordination challenges drive some of this preparedness, the need for role-based preparedness and political preparedness, which then allows you to align the kind of downstream impact. But it is a huge point. We wrote Anjao Mina and I, a colleague and I, wrote a piece in Foreign Policy a couple of years ago, or a year and something ago, comparing this period to the Warring States period in pre-China. And essentially that there was this, what is the definition of a state? What roles does it take on versus what things are managed by private industry, by private citizens? And so there is this sort of fascinating definition of the modern state that goes into the creation of modern China. In a lot of ways, picking up on previous points about clashes of industries or multiple fields finding each other. What we're really finding here is in the modern evolution of the digital state, where do we redraw some of those lines around sovereignty, which I think are some of the points that you're making, Professor Erickson, which are really, really important. But I think that so often it is about getting to that agreement of definition of the outer bound, and then the mechanics fall into place. When the mechanics drive, it almost always goes off the cliff.
Thank you so much, Sean. I want to bring in a question from the audience. It's from Laura Mann, who asks, are there any interesting differences between US-based, India-based, EU-based, or China-based tech firms in their attempts to deploy technologies and integrate into public health in other countries? The floor is open to whoever wants to respond.
I think maybe this is stating the obvious, and it has been echoed already in some of the comments that Susan and others have made, which is that in a country like China, you're not really looking at a single company producing an app in isolation and launching it into the population. It is part of a much more integrated, sometimes explicitly planned technological infrastructure, which also guarantees a certain success in a way that if it is this isolated technological development, which has to be integrated into existing bureaucracies, the way Susan has been pointing out, where Sean commented, there's going to be a lot more friction. So I think the political economy, the landscape of technological development in a country like China around these public health digital apps and surveillance apps is fundamentally different than what you see in the United States or Europe.
Thanks, Manjari. Anyone else want to comment on that question?
I think you just see a lot of the importing of the national, presumptions of the political character of the place in which the technology is produced. I don't know, sometimes I think they're justified, sometimes probably not, but I think that there is a lot of assumptions about how the power dynamics will play out based on where the company comes from.
Thank you. And there's also a question from Turth Engir about whether there's a way to implement these kinds of apps or technologies in ways that do not breach privacy. Is there a way to do this in a way that really guarantees the public interest is at heart here?
sorry.
You can continue, Sean.
I promise I'll shut up after this. The deployer would have to define its intended impact for anybody externally to be able to measure success. But I think that during times of public emergency, privacy, as has been mentioned, while important, is certainly not the totality of the issues. And so, this is about an integrated public health response. So, is privacy the thing that we want to hang whether or not we're sharing information with public health authorities, how it is that we articulate the remit to exchange, to share that with researchers. There are lots of emergency power gaps, essentially. We don't really define what a government's digital emergency powers are the way that we do with like eminent domain and real property, or, the suspension of various regulatory functions. So I think that that's a real opportunity to look, but I don't think that it's less about privacy and more about being able to uphold the integrity of who you're sharing data with, in a more consent and obviously legitimate purpose framework. And then it only being those, and there being credible limitations to make sure that those conditions are met.
Thanks, Sean. There's also...
Sorry, quickly, just to add to Sean's point as well, I think a kind of an interesting arc in this discussion that we often come up against as well in topics of public health emergencies or surveillance is this kind of constant duality between, on one hand, public good or good for the community, with privacy. And I think it's also quite important to highlight that, especially within healthcare provision and the politics of health, and also governing public health emergencies, there are often pre-existing provisions that allow for the compromising of some personal security in public interest as well, right? So these are things that are clearly articulated and on the books kind of in non-pandemic settings as well.
Thanks, and I want to just bring in a comment from the audience from Kate Meager, who notes that it's perhaps also important to note the ambiguity of government on regulatory issues, given the many pressures that come from big tech about their importance in job creation, economic growth, and innovation, where really economic fears are key. So I think this is a very interesting comment, actually. I think we're going to try to change tack a little bit to a new topic, that of equity. And I want to turn to Susan, because one of the concerns about the rapid deployment of digital innovations is the way that they don't necessarily improve equity. They can fail to benefit the most vulnerable segments of societies, or worse, they can enable their further discrimination. Susan, do you worry that the new digital surveillance technologies that we're seeing rolled out many places now will fail to benefit public health and instead deepen existing inequalities?
Yes, very definitely. And so if we take even just the simple use of big data to identify where people are located who are sick, the clusters in Canada, for example, the sickness clusters have been in the long-term care facilities. So for elderly people, as well as people who are otherwise in long-term care. You also see clusters in prisons and also in meat processing plants. There was the big outbreak in Germany that shut down a part of Germany just yesterday. So what we're seeing is that, in fact, we don't need the apps to actually know where the most of the sicknesses are. So there's those particular vulnerabilities relative to the use of anything that relies, any technology that relies on or is said to reveal location. The other element to this is that there's now apps that are using the location data to then do social distancing reporting. And then there's the issue of, you have the data, but then if there's social distancing, physical distancing enforcement, what does the enforcement look like? And there was a recent report about the practices in New York City where police data reveals stark racial discrepancies in social distancing enforcement across New York City. So here's a technology that is assumed to be unbiased and objective and apolitical, and yet the enforcement of social or physical distancing is, in fact, done by public servants who are well known now for discriminatory practices relative to racialized groups. So these are social concerns that we should be integrating into our conversations, because I think if governments are deciding about whether or not to use certain apps, I think that these kinds of issues need to be part of the conversation, because I think there's a view that, in fact, the inequitable outcomes that we can actually reasonably and evidentiarily deduce just by using logic, social science, and thinking it through and having important conversations together, I think that they are reason enough not, in fact, to deploy them.
I can add a point to what Susan was saying as well. It's very relevant, sort of, it speaks to the current experience here in the UK as well. But I think when we're talking about equity along the lines of these technologies as well, you know, part of it is also questions of access. And, you know, theoretically, if there's benefit, who has access to this? And I mean, this has been illustrated, you know, very starkly recently here in the UK, where there was a large-scale health survey done by Ipsos Mori. And what the survey essentially revealed was that on the contact tracing app that was going to be practiced through the smartphone here in the UK, 17% of respondents over the age of 65, which here in the UK, you know, the standard is that they are the high-risk group, they weren't able to possess a smartphone, right? And sort of equal to that, you know, respondents in lower socioeconomic and also educational settings as well, 25% of those respondents said that they didn't possess a smartphone as well. So in many ways, I think it's also interesting that, you know, when we talk about access to these technologies, if there is benefit for them, the drive to adapt and use these technologies is also laying bare the, you know, the existing inequities that have always been there.
So I think this question of access and accessibility is magnified several fold when you go to poorer countries like India, which I study a bit, where questions of who has smartphones, but also who has mobile phones is not something that you can take for granted. There is very often a strong gendered aspect to who has access to mobile phones in many countries. There is a rural-urban divide to, you know, also not only owning the gadget, but having access to cellular networks in places. So this question of access and accessibility is absolutely central when one talks about equity. But I think the equity discussion also has to be slightly broader in talking about how the rollout of these apps and the emphasis on digital technologies ends up potentially, but also we have known, you know, kind of tangibly reconfiguring and reshaping priorities within public health systems. You know, where do people go to work? Where is the excitement? Where does a government wants to start a new program? What does that end up remaindering in terms of local in-person health visits for you know, maternal wellness or vaccinations? Because all the excitement and the hoopla is around this new digital rollout, certain set of older services end up getting neglected. So there is also a set of trade-offs of how health systems get reconfigured, which is very much a question of equity, because these digital technologies end up privileging, as Stephen pointed out, you know, urban populations, educated populations, economically more well-off populations.
Thank you, Manjari. I think we're going to be returning to this question of how health systems get reconfigured and what gets left out in a moment. But I'm interested in this issue of access, because even here in Norway, where we have almost universal access to mobile phones and coverage, and of course very little social inequality, there have been issues about inequality and access to these apps, whether you have the latest operating service system or can read, or language issues, etc. But I'm interested in what Susan said about how the social concerns that you've all been speaking about need to be integrated into the discussion. But is there a way that these concerns can also be integrated into the technology? Perhaps, Sean, you could comment on that.
Well, I think adoption plays a huge role in equity. And I think, you know, our work at Frontline SMS is based on SMS because SMS is the most used two-way platform in the world. it has an adoption base several billion larger than the entire internet combined. So, when we're thinking about how the role of platforms play in, I think it is, looking at adoption as the outer bound or as an early determinant of the equity of any intervention is absolutely critical. So yes, and with all of the previous comments, but the one thing that I would encourage us to think about is that we're talking a lot about what technology does or the effect of relying on technology, but it is in fact governments and public health authorities doing that relying. And a lot of the inequity, a lot of the unbalanced decision-making that gets based on this data is because decision-making gets based on this data, which is knowably flawed. So I think that there are really low-hanging fruit, easy opportunities to work with governments, not only in a capacity building sense, but in a sort of in a public education and engagement sense around closing some of those gaps. Because I think it's recognizing that what we're doing is solving a public health problem through a technology, not perceiving a public health problem through that technology. And so it has, any view to equity has to be based on a sort of accountability to equity starts with the government, and then the technology design has to sort of flow from that.
Mm-hmm. Thank you so much, Sean. I think this issue of governments also consulting evidence is interesting here, because of course this isn't the first time that we've seen the use of digital tech in trying to manage a global health emergency. Susan and Sean, you've both been involved in researching efforts to use big data to do contact tracing during the Ebola epidemic in West Africa. And it would be interesting to hear your views on what lessons we can draw, but also what lessons governments should be drawing from these experiences that are transferable to our current pandemic. Susan, why don't you go first?
Well, I just returned to the point that I led with about whether or not they actually work. And in the paper that I wrote in Medical Anthropology Quarterly in 2018, that paper was really born out of understanding why it wasn't going to work. And it was just a logic that had not been considered. And also to know so intimately the situation in Sierra Leone as I do, from having worked there a long time as first an international affairs worker and then an anthropologist, I had concerns about what it meant for Harvard computational epidemiologists to come into the country and then take up the time of UN and government, Sierra Leonean government officials in the middle of an emergency, trying to get a project that was never going to fly, a model that was never going to work. And if we actually, again, I get back to the earlier point of breaking things down enough to actually understand why something will or will not work. I also want to say that, there's a lot of humanitarian technology that does work, and I'm all over that. I would endorse that in a minute. But when we find technologies that don't work and that they're being imposed on in times and in places where time is short and resources are scarce, for me, then it becomes a value question of the world we want to live in and whether or not, what our role is actually in doing the analysis to show, you could have worked this out before you actually wasted all this time. And I do think it becomes a values question.
Thanks, Susan. But that's interesting that you talk about this imposing tech at a time when time is short and resources are scarce, because those are precisely the justifications for rolling out the app here in Norway, for example. Contact tracing is too resource intensive manually, and time is scarce. It's an emergency, so let's roll it out. But Sean, from your experience in the Ebola, looking at the Ebola outbreak, what lessons can we draw for the current response to COVID?
Yeah, the shortest one I think is that you can't technologize trust, and that statistics don't do it and apps don't do it. My we not only did I sort of study the Ebola response, but we were the front line was used in elements of the response. And one of the sort of really interesting pieces that I think happens when we focus on a technology lens is that we decontextualize that technology. So people were sending, there were more than 300 separate SMS-based interventions during the Ebola response. And a question sort of became, how many text messages from a stranger would it take to convince you to change the way that you buried someone you loved, right? Because that's the problem that was being solved in a lot of the Ebola epidemic, was that burial rituals involved a lot of touching, which is when Ebola is most transmissible. So no number of text messages will do that, incidentally. You are not solving an information problem at that point. And I think that like one of the things that we have to recognize is that particularly in places where technologies play a lesser role or a much more suspected role, there's simply no technology solution to solve some of these core institutional service delivery expectation problems. There've been a number of Ebola epidemics that preceded the 2014 epidemic and have come after. And in fact, the Democratic Republic of Congo, unfortunately, is just back to some cases, but actually mounted a very impressive response in their context and built very trusted local public health institutions as a product of doing it consistently and over time. And they do it in a very manual way. And just to sort of pick up on one of the questions I think has come up in the chat, there are the value of human contact tracing is that it connects you to an institutional care setting and to actual testing, whereas an app obviously does not do that or does not do that as directly. And so what we're talking about here is that someone is not running up to you and saying, hey, maybe you have the worst disease that you've ever considered and don't have any access to care, but good luck out there. And one is saying, hey, you may be at risk, but let us come help you, and let's get you the source of security that you need to deal with this, right? So when I'll wrap up here, but the other thing to say is, in most instances, we design professional responsibility around healthcare because we recognize that the presumption of illness, that the impact of health information and diagnosis is an incredible act of trust and one that happens in the public interest. And so we require people who are giving you diagnosis to do so in a context and in certain ways to protect that trust. Apps obviously can't do that, and replacing a probabilistic estimation with an actual diagnosis as a way to get around that can often degrade trust. So I would just say, like, putting technology in the context of what we actually feel like we need when we get terrifying health news is a really important way to kind of understand the total value of any particular intervention.
Thanks so much, Sean. It reminds me of a point Susan has made previously in conversation that, the contact tracing app can't give people the reassurance that a human can when you're faced with the possibility of having a very serious illness. We've been focusing a lot on the contact tracing, which is, of course, a technology which interacts with the user in some way, but there are a lot of other technologies that are involved in our management of emergencies and crises. And social scientists have written about the notion of algorithmic governance, the tendency in decision-making to rely increasingly on mathematical models and algorithms. And this has been something that you've been concerned with, Stephen. I was wondering if you could maybe reflect a bit on how this is playing out in the context of the pandemic.
Well, I think a really key point to remember is that in most of the contexts, Katerini, in which algorithmic decision-making or algorithmic profiling or governance by algorithms is referred to has been applied and has played out in a lot of previous settings, whether we talk about market regulation, whether we talk about banking and credit score assignments, healthcare insurance coverage, judicial decisions in some cases as well, is that the defining feature that we continually see is that the data collected in many of these cases by these opaque processing systems are inherently biased. And they increasingly and consistently have impact on, as we said, overly surveyed communities, marginalized communities, communities of color. It affects over gender lines as well. So I think the point that I would like to also add in the context of the technologies that we're increasingly seeing playing out in the context of COVID-19 that use algorithmic data collection for a minute is that all of these areas previously have been extremely problematic and discriminatory as well. We need to be prepared to see this playing out in the context of health surveillance as well during COVID and post-COVID as well. And I think it's also happening at a really kind of critical moment when we see, obviously, the Black Lives Matter movement around the world, which, you know, tells us that, you know, much of the data collected from societies is inherently biased and racist as well. So we need to be on the lookout for these same tendencies and dangers within health surveillance as well.
Thank you, but is there a way to eliminate that bias in the algorithms, or is that an inevitable consequence of the technology?
Well, yeah. No, what I was going to say is I tend to take an optimistic view of this, but I would also welcome the panelists who might have more of a sort of a technical approach to this to sort of elaborate their expertise on that further, because I would be interested to know from a technical perspective what can be done.
Susan, you wanted to comment, right?
Well, I know Stephen's work has actually focused on trying to reduce algorithmic bias, and his commentary has been quite astute on that point. But I also want to borrow from Kathy O'Neill, who's talked about algorithms are opinions embedded in code. And because algorithms are written by humans, they are inherently biased. And while we can work to reduce that bias, one of the problems with algorithms is the assumption for people who really aren't looking too closely at them that they are unbiased and objective. And for me, that's the danger and also the power, is that when you don't break it down, you can't see where the bias is, and you don't even really think about the fact that algorithms and the way that they're, you know, the code that is embedded in them or embeds them it's put together by humans. And I think that that's just an important thing to keep in mind, because how far can humans get away from subjectivities? You know, this is a human and existential dilemma, right? That we're not likely to solve. I think we should continue to work on issues of algorithmic bias, but at this stage, you know, at this historical moment, the work is really about just getting people to acknowledge that data itself is biased and that algorithms are opinions embedded in code on just a very fundamental level of understanding.
So if I could just add to what Susan said, so there are questions of opacity, there are questions of transparency associated with models and algorithms, which are difficult to crack, especially if one is an non-technical public. But then there is also a historical context of what the alternatives have been to collecting data that can inform policymakers. And it's not as though before algorithms, there were not other sources of data. And I think one of the contexts in which a lot of these digital apps and the data that they produce has become so attractive, especially in poorer countries, is because it's taking place in the context of highly depleted statistical systems that have been run by states. These systems, these statistical offices have been defunded, they have been depleted politically in terms of resources, in terms of status. And so what you really see is that data is replacing statistics. So there are alternatives to app-produced data, but those alternatives have both been historically sidelined and get only further undermined with our emphasis on digitalization.
Thanks, Manjari. And before we move on, we're going to have a very quick comment from Sean. And at the same time, I'd like to invite the audience to pose any last questions before we close.
Yeah, sorry, I just want to say that we have lots, I'm trained as a journalist, so we have lots of systems for admitting the failures of objectivity and for placing clear signals to subjectivity into compromisable and compromised systems. And the scientific method is one of them, right? That we are trying to take all of these things that we know to be political assertions and trying to compare them through a transparent framework of methodology. Anyway, just to say that I think, yes, it is a huge, and there are huge issues here, but that we do also have models for addressing these. So I think it's important to recognize that we have frameworks by which we can start to move forward.
Thanks. You know, we've talked, I mean, there's been so much hype about new digital technology, about algorithms, about apps, etc. But in practice, what a lot of the governments around the world are doing now is more low-tech interventions and public health responses, whether it's training health workers or implementing social distancing policies, etc. We're doing old-fashioned detective work of manual contact tracing. So it raises the questions of, I think, which many of you have already mentioned, why we're not talking more about these efforts. And it brings up also a question from the audience, from Remco van de Pas, who asks, from a public health scientific perspective, have tracing apps actually proven to be more efficient than traditional tracing and public health methods? And you're shaking your head, Sean. Anyone want to contradict that? No? I think we have, as far as I know, there hasn't been much evidence to suggest that they are being, and I think Susan Eriksson also mentioned this at the start of her comments, that actually the evidence base for this is very weak. But I think what we do know is that mathematical modeling to project the success of these interventions has been very seductive. Here in Norway, for example, we've heard that the Ministry, the Institute of Public Health has been told that by implementing a contact tracing app, if you manage to achieve 60% uptake, that in itself will be enough to curb the pandemic without any social distancing or hand washing included. So it's incredibly alluring.
Let me just jump in and directly respond to Remco's question. And that is, one of the things that's misunderstood relative to these tracing apps, fairly widespread misunderstanding, is the fact that manual contact tracing still has to be conducted, and that it's not a either or, it's a manual contact tracing will be conducted, and then these exposure notification apps may need to fit in to the manual contact tracing. So, you know, when I was speaking earlier about technical sovereignty, this fitting in of the contact tracing information, if you just think about it as an extra step that needs to be taken, does it introduce efficiency, or does it in fact complicate efficiency? Is it in fact producing knowledge, mostly largely already known, good enough knowledge that would actually achieve the public health goal, to not have them inserted into that manual contact tracing process? So it's not an either or. The contact tracing apps alone, the notification, they're also now Apple and Google are being a little bit more discretionary about how they use contact tracing apps, and they're calling their contact tracing apps exposure notification apps, because that's more of what they do. They aren't actually accomplishing the contact tracing. And I think that that's an important, you know, public education kind of issue for people to know.
Thanks very much, Susan, for clarifying those important dimensions. And there's been a comment to the earlier point that was made about the undermining of statistical systems. Kate Meager notes that this shifting of the locus of data ownership and control from the state to big tech is also an issue. Does that play a role in these questions? I think we're going to have to leave that an open question because we're running out of time. But before we close, I want to just ask each of the panelists a yes, no, maybe question. Will digital tech save us from the pandemic?
No.
I'm an eternally optimistic person, but I haven't seen it yet.
I think we have to do the hard work ourselves. And I think when we come back to all the things we've discussed today in this really great forum, when we talk about political challenges, when we talk about implicit bias in society, when we talk about social determinants of health, these are all things that we have to do the hard work. I mean, if we talk about what big data can do for us, we can talk about it perhaps in supplementary or complementary terms, which, as Susan said, is also problematic as well. But no, ultimately, we have to save ourselves, and it's us who have to do the hard work.
Thank you. Yes, no, maybe, Marjorie. Short.
It's one small tool in a much more complex toolbox, and that tool has to be designed very self-consciously with many different voices at the table. It's not a given shape or size of the tool that we can take for granted.
Finally, Sean, will tech save us?
No. Our instrumentation is meant to support the best of us, not dictate it. And so I think we need to reflect that what we're doing is reflecting, not driving.
Thank you very much. I really want to thank all of you panelists for providing what I found to be incredibly insightful comments on the difficult dilemmas and conundrums that we face in managing these new technologies. And I also want to thank all our viewers for taking the time to engage with us. And for those of you who asked questions, I'm sorry we didn't get to all of them. A recording of this event is going to be made available. And you can also watch out for a news story about this discussion from Health Policy Watch coming up soon. I also want to thank Sakiko Fukuda-Parr, Elaine Fletcher, Antoine de Benji-Pouibaye, and also Matthew Turner for their role in organizing the series. And the next webinar will be on July 22nd. It's going to consider the links between COVID-19 and environmental issues and the impact on inequality globally. Thank you all very much for joining us, and I hope to see you again next time. Bye-bye.